Well, before we wrap up September, we want to recognize Gynecologic Cancer Awareness Month. And there's a free event coming up that you and your family are invited. Here with all the details, Dr. Renee Cowan and Shauna Sanford. They are with Women's Hospital in our area. Thank both of you all for joining us this morning. Dr. Cowan, I'm going to start with you because I learned something new just in talking before you came, is that there are 5 different cancers when it comes to GYN. Just tell us a little bit more about it.
Yes, so the GYN cancers involve the organs below the belt, the ones that we don't like to talk about very often. But you have your uterus, your fallopian tubes and ovaries, your cervix, your vagina, and your vulva. And those are all organs that are involved in childbearing and the reproductive system for the woman. And any of them can develop a cancer over the course of a woman's lifetime. And during September, we really like to acknowledge these cancers and try to bring awareness. A lot of women aren't aware that these organs can get cancer. A lot of women go through their reproductive years, and once they're done having children, don't ever see their gynecologist again. And then unfortunately, some of those women will end up in my office with a cancer diagnosis, and we're worrying about what to do then. And we've sometimes missed an opportunity for prevention or capturing something that happens early.
So tell us a little bit more about, I guess, the importance of advocating for yourself, I guess, if a woman sees something wrong with her body.
Yes, I would really like to encourage women to, if you see something, say something, and don't ignore those organs. Just because we don't like to talk about them, just because they may be a little bit taboo, let's not ignore anything that's going on. If bleeding seems abnormal to you, you should tell somebody about it. Tell your gynecologist, tell your primary care provider, let them know. And if they seem to push you under the bush, which most of our doctors don't, but just in case, you know, you've got to tell somebody else, because if it doesn't seem right to you, it's probably not right. If your sister, your aunt, your mother, your daughter, if somebody's like, oh, I've been having this weird bleeding, even though I've gone through menopause, that's not normal. And so many women are just like, oh, it was just one spot of blood, and then, you know, you've forgotten about it. No, if you see even just one spot, you need to tell someone. If there's some itching down there, don't just put some cream on it and forget about it. You know, bring it to somebody's attention. Ask somebody to biopsy it. You need pap smears. The pap smear guidelines change frequently, but as long as you keep in communication and keep a good relationship with your gynecologist, they'll stay on top of it and make sure that we can catch things before they become too big of a problem.
And so, of course, Shauna, you all are hosting this inaugural event called Make Your Health a Priority. Can you just tell us when, where it is, and what can people expect when they come out?
Well, I can tell you can expect much more from Dr. Cowan. As you can see, she is full of lots of great information. She is going to actually be the keynote, so we're looking forward to this. As you mentioned, it is the very first time. This is a great partnership between Women's and Southern University. It's happening this Saturday at Southern at the Valdry Center. It's from 10 to 1. It's absolutely free. Lunch will be provided. There are going to be wonderful conversations and activities for anyone and everyone who comes out, and we're really encouraging the community to take advantage of this opportunity to learn from Dr. Cowan and the others who are going to be there. Dr. Cowan, I'm learning so much from Dr. Cowan, and one of the things that she said to me, and I don't think that we can emphasize this enough, is that as women, we should always have a relationship with our gynecologist, yes. Right, Dr. Cowan?
Absolutely, absolutely. Do not, just because you're done having children or you decide you don't want to have children, or you maybe ignore those organs on your own, let your gynecologist pay attention to those organs. I know nobody likes to go. People come to my office and they're like, I don't want to be examined. Well, I wouldn't go to the dentist and not open my mouth. Like, you've got to be examined. These organs have to be examined. They have to be checked. If there's a mass, if there's a growing, sometimes the symptoms are very vague. Sometimes you've just got this bloating, these changes in your bowel habits, changes in your urinary habits, things that are just very vague and you don't know what it is. And you just need to tell somebody about it. We can look into it, check into it, and make sure that it's nothing. And then you can go on with, you know, whatever you were planning on doing.